Beck, Chair of the Price County Health and Human Services Board. I'll call the meeting to order. And Meredith, would you please take the roll?
Good morning. Joe Baratka,
Here.
Paula Hodek,
Here?
Robert Kopish, Patricia Stephen,
Here.
Dennis Wartko,
Here.
Peter Daly, Sally Hummel, Suzanne Acker. Are you online?
Susie here?
There is one call.
I didn't get a note from her, so.
Did not either. I didn't hear anything.
And Gerald Swenson,
And I did not hear from Gerald either.
nor I.
Boy, that's not
He said
usual.
last meeting he wasn't gonna be here.
Okay. Thank you for remembering that. Okay.
Thank you.
All right. So Susie, we just don't know. And maybe she'll still log on. We'll watch. CU doesn't. Okay. All right. So at this time, we have items for discussion and possible action. Number one, we have public comment. Is there any comment from the public? Looking and seeing none. We'll move on to any communications from the board. Okay, seeing none, we'll move on. The vouchers have been passed around. Mr. Kopish, are they in your hands yet, or? Dennis, where did it go? Is that the,
Yeah, that's.
yeah, it's a real thin. Yep,
Yep, at the back.
yep, okay. Any questions, though? Chris-Ann is just
Yes,
waiting.
Yes, I had a whole list.
Oh, gosh, look at that, Chris-Ann.
I know he
I
already.
thought
showed
I'd
me.
be nice and we sat down and looked at it before the meeting.
Okay,
But there's one on here I think it's worth talking about, and that has to do with a payment, Mart, of $80,615. And I thought, boy, we bought him a whole bus or something, but you can explain it.
Yes, I did talk to Chris a little bit. So it is the local, Phillips and Park Falls only contribute about 10 to 12,000 toward it.
Okay,
So
that's
the
what I
rest
thought.
is covered under a grant though, our portion, but
But it's covered under the 8521 grant.
Okay. So most of this is county, but through a grant.
Yep.
So how much is the county like on, that would affect our levy?
None of that does.
None of it is.
We have a match. Like the 8521 grant has that match. Right.
So is this the total amount we pay and then on top of that is our 20% or how does that work?
We use other matching funds though.
Yeah, like
Yeah.
it's part of the whole transportation thing, but we do for the 8521 have to report that back to Wayne.
Okay, so what does the county, how is we affected on levy?
Well, their whole department would be, you can use that as matching. So we give Bay Area Transit pretty much the grant money. The 20% match is just other things we do throughout that department.
So
would've-
so it's really not a specific levy item
No,
that
like
affects.
if
the-
we stopped doing it, we'd have money to do other programming, but
Okay.
the 80 or
Okay,
the 80-20 match, the 80% goes to them, the 20 matching is just other areas of
Okay.
the program.
but
We
this,
also get, like Chris said, is it's either 12,000 from Park Falls and Phillips or 10. We're working on increasing that because obviously over the years, this program has cost more and more, including buses. So
okay, so this is the total amount we give to BART for the year.
correct.
Okay. Made up of a bunch of different stuff. But our part basically is grant covered or in
grant
some
funded,
manner,
yeah.
fashion. And then there's the direct contributions from the two cities, which they could cover that with grants too, but we don't know that.
I don't know how they
Yeah,
pay, if
okay,
they
all
use
right.
levy or.
It is broken down. Cat has it broken down for the Minocqua route, the Phillips route, and the Park Falls
Woodruff.
route.
Yeah, what, how much of our grant goes to each one of those for that billing?
And how are they doing in general? Are they doing okay as a entity?
They've done really well in this area. We talked about the veteran service rides
Yeah.
are way up. The biggest issue they're having right now is in Park Falls. They've almost hit the limit of what one bus can do, or they have
Oh.
hit the limit. So there's no plans on adding, but it does make the service a little bit slower. You know, it's not as instant call and get a ride. You do have to plan ahead.
Right.
But that's a future problem
Yeah.
to deal with.
Okay.
And then we did check on the lock boxes or for medications, metal boxes with combinations for people to, keep their meds locked up until someone can open them for
Yeah.
them.
Yeah. Okay. Well, thank you.
You're welcome.
Just a quick question, Joe, can you hear all the conversations that are going on?
Yeah, I can, a little bit quieter on when not using a mic, but I can understand it also. We're fine. Thank you.
Okay, okay. I mean, I could have asked them to come to the mic, but if you're able to hear, that's okay, unless there are others that are having concern.
You could hear me, Joe, right?
I can always hear you, Bob.
Thanks, Joe.
All right, thank you. Any other questions for Chris Ann? All right, thank you. All right, so now we need a motion to, okay, Mr. Warco, you're ahead of that. Makes the motion to approve the vouchers.
I'll second.
Mr. Kopesh seconds it. Any other discussion? Hearing and seeing none. All those in favor?
Aye.
Those opposed?
Aye.
That was just a delay. Yeah, there's that delay. Sorry about that. Okay, good. Minutes from the February 12th, 2025. Motion for Mr. Wartko to approve.
Second.
Mr.
Second.
Kopish seconds that. All right. Is there any discussion about the minutes? Hearing or seeing none? All those in favor? Those opposed?
Aye.
Okay, minutes have passed. Sorry, I need to give that teacher wait there for a minute. All right, let's move on right on to the public health unit. Tiffany Polachek. Good morning.
Good morning. All right, I am just going to present a little bit of an update on our communicable diseases, most specifically those that are vaccine preventable at this time, with the exception of the avian influenza, which we'll talk about last. So about every week we receive a report for influenza, RSV, COVID-19 activity that kind of gives us an idea of public health, what things are looking like in Wisconsin, and a little bit of breakdown of what it looks like in the northern region area. Off of that, then we can do further outreach to our schools and making sure that we're promoting our vaccine, where people can get it, the cost, and just providing that overall education on them. So one of the bigger things that we've seen lately, just circulating around, is measles. As we're not seeing it here in Price County, but we are getting a lot of information from, from the CDC, from DHS. So right now, just to give you an overall idea, the latest report showed that there's 222 measles cases that have been reported as of March 6th. About 94% of them were unvaccinated or unknown vaccination status. 17% hospitalized, one confirmed death, and another one under investigation. Here in Wisconsin and in Price County, we have not seen any cases. What we have been kind of monitoring is our vaccine status or our vaccination status of our school age population. Some of them, right now, the most recent data that we have published is from 2023, which was showing that about 73% of like our 2-year-olds have gotten at least one MMR. And then about 70% of our Price County children, about 5 and 6 years old, are getting 2 or more. So that's still 30% of our population in our youth that have not received that vaccine for preventative purposes. So that is something that we continue to monitor. Right now here at Public Health, we do offer the VFC vaccine or the measles vaccine under the MMR. It's a combination vaccine, and that's provided for the Vaccines for Children program, which is provided by the state. Unfortunately, right now, we don't have any private pay. Most children are receiving that. If they have private insurance, they're receiving that at their medical provider. But that could be something, if it becomes a concern, that we could definitely look into if we have to extend our outreach a little bit further. And just to kind of give you an idea, 82% of the cases right now out of those 222 are under the age of 19. So we are looking at that school age population. Kind of just a little bit of breakdown on pertussis and whooping cough. I know we talked about the communicable disease during our quarterly report last month. Right now, Wisconsin's about 182 confirmed cases. You can see the age range there. No deaths have been reported. Oh, sorry, Mr. Brock, I realized I didn't give you send out the stuff ahead of time, so I'll kind of read through some of more of the points so that you can kind of hear them too. The cases of pertussis are ranging from 4 months to 78 years old, and we're seeing about 34% of them are in like that middle school to high school age range. So we had seen some cases more in the fall of 2024. Right now, we've only had one case in 2025. Again, continue to monitor the vaccine status. Right now, some of our reports are showing about 82% of our 13 to 18-year-olds. So that middle school to high school are getting the Tdap. We still have a little bit that aren't getting it. Some of our schools are hitting a higher threshold. Shawamba School District, they have a school nurse that's employed there, so I do see that some of their vaccine numbers may be a little bit higher, but they have somebody that's right on, able to work with that. We do offer the Tdap vaccine at Public Health. In January, the state changed our ability to provide that Tdap vaccine to everyone because of funding. So one of the things that we are looking at is we do have it for those that are uninsured, but we are looking at getting it for like a private pay vaccine so that we have it available. So if for those that do have private insurance or wish just to pay out of pocket, would have that availability to get it through us, since there was that change in what we're able to use that VFC vaccine and the VFA vaccine for. Varicella, which is chickenpox. There's about 30 cases statewide, no deaths reported, and about 67% of those cases have had no vaccination recorded or no known doses. Right now, we have not seen any cases in 2025. Again, we do offer the vaccine through the Vaccines for Children program. Mumps, Wisconsin's had 3 confirmed cases in 2025. Price County has not had any confirmed cases. We did have one case that we had a positive antibody, which, but it was a long duration of symptoms from our awareness. A PCR was not completed to confirm that, but there was no subsequent cases that came off of that. So whether or not that truly was, they kind of consider that either a suspect or a possible probable case, but nothing that we have confirmed here. Some of the ones that we're more used to seeing, influenza, COVID-19, and RSV. Wisconsin's been having a high activity level of influenza. We mimic that here in the northern region, but we are seeing that those numbers are starting to decrease. Here in Price County, influenza-associated hospitalizations are reported to us at Public Health, and we've had about 14 of them so far in 2025. Looking at vaccination numbers, we are seeing that trend had been down this year. About 33.7% of Wisconsin residents received a dose of flu vaccine this season, and about 30.7% Price County residents. Again, we continue to offer the flu vaccine, both for those that are insured or uninsured. Our high dose, our flu block, and our regular vaccine are all available. Going on to COVID-19, that activity has been reported low for some time now, and that continues to be at a lower end. We haven't had any, I don't believe we've had any COVID-19 associated hospitalizations reported to us in 2025. I don't have any data on that. And we're looking here about 14.1% of our Price County residents have received at least one dose of the updated 2024-2025 vaccine, whereas the state is about 16.5 as far as getting the vaccine for that. We tend to see that that those that are 65 and older are the ones that are opting to get the vaccination. So we do continue to offer the Moderna vaccine. We have it for both 6 months and up to age 11, and then the 12 plus vaccine formulation. So the cost for that is about $150 if you are paying out of pocket for that. So RSV, that had been high. Actually, here in the northern region, they had listed that in the most recent report as very high still. We're seeing that in our children under the age of 5, and we've had 2 RSV hospitalizations. per the most recent report here in 2025. So for the recommendation for that vaccine, it's those 60 and older can receive 1 dose. Infants and kids, they can either get it it's the younger population. So usually for pregnancy, anywhere between that 32 to 36 to 37 week, mom can get a dose of the vaccine, which then provides immunity for the child, the newborn when they're born, or they once the baby's born, if they're going into that RSV season and they're less than age, if they're newly born or if they're less than age 8 months, they can receive the monoclonal antibody, which will give them protection for RSV.
Tiffany, what is RSV? Is that a respiratory?
Respiratory,
Yeah.
yeah. Yep. And oftentimes what you'll see is that it presents much like a common cold, but in our younger population and in our older population, it can lead into, more serious complications such as pneumonia, bronchitis and the such. So, which then, with those little tykes, it can lead into hospitalization.
Even with these vaccines, they can get it again and again and again.
The RSV. So, yeah, that's a good question. Sometimes I think that it kind of is dependent. They're trying to provide the vaccine to those younger populations that are most at risk. But yeah, there is that chance that they could still get the RSV, the actual virus. It may be less severe if they've had the vaccination. And again, just like influenza, there's that possibility that virus could mutate a little bit, and then they could end up getting another formation, if you will. So,
But it's not like chicken pox. Once you've had it, you're done.
no.
Okay.
Mm-mm. And then the avian influenza, the H5N1, nationally, they've had about 70 confirmed human cases reported. Per the report that we would receive, it said it was reported since 2024. There's been no person-to-person transmission at this time. And right now, the public health risk remains low, although we all stay very aware of what the situation could be like. Wisconsin has had 1 confirmed case since 24. Price County, we have not had any cases. So, but if there would be a potential case, if they would go into the physician's office, they would alert us, and then we would be in contact with the Bureau of Communicable Disease through the state. And from there, then they would do testing right at the state lab of hygiene, and then we would follow up as such. So.
Any questions for Tiffany?
Madam Chair, may I?
Yes.
Just a quick question.
Ernst.
Measles and mumps back when I was a kid, seems like everybody got it. And in my mind, it wasn't a big deal. It's just something we all got. Are these measles and mumps today a mutated version that we should be more concerned about? Or is the concern that we had it almost eradicated and it's showing up again?
I think it's a concern. I think one of two things. It was eradicated. It's coming back. We're mostly because we're not seeing that herd immunity. We didn't see it for quite some time. The vaccine came out, people received the vaccine. Even those that didn't were sort of protected by that herd immunity. You have enough people vaccinated, it's not going to circulate in the community. We are seeing lower and lower vaccination numbers. I think the reason why it's coming back out more is because we are seeing some of the complications with the hospitalization. Right now, I know we're looking at 17% of the cases being hospitalized. If I would have given you a report 2 weeks ago, that number, that was higher. I think it's just that we don't want it to get to the next step. In public health, we're always working on prevention, getting that awareness out there. We've gotten it to this point. We don't want it to get further where we're talking that we have, thousands of cases. But as we know, even here, it seems like it feels like even our overall respiratory illnesses have been more severe this year, especially in our school age population. So there is that possibility that we're seeing like co-infections. So we're seeing the measles, but then it's also accompanied and worsening, they're getting something else with it, the pneumonia and things like that. So, and whatever else that could be out there. So I hope that answered your question.
Yes,
Okay.
thank you.
Okay.
Are there any other questions for Tiffany? Okay, well, thank you very much. All right, Aging, Disability, and Senior Services Unit, we have Chris Mabey and Dawn Griesel, but we'll start with Council on Aging Advisory Committee with Chris.
All right. Hello.
Hi.
So on Monday, March 10th, we met in Brentwood for the Council on Aging meeting. I just gave updates on various programs. I talked about the Strong Bodies. The winter session for that program had 114 participants throughout the county. Cheyenne is working to get new instructors so we can expand the classes. Let me see here. In February, the Adult Protective Services Unit visited all the nutrition sites just to give presentations, and that would have been from Dawn's unit. The art students from the Prentice School District made Valentines for all the home delivered folks receiving meals and were distributed in February. We purchased approximately 90 Valentine gift bags, filled them with chocolates, and delivered them as well to the home delivered folks. We did them for the Red Apple group too. We are in the beginning stages of planning for a senior living expo in the fall. So stay tuned for that. We are again hiring for a driver for our meals in Ogama and Prentice because that driver quit. She moved out of the area. So right now we have one sub for down there. The other sub quit. So that sub is currently driving. So hopefully we'll get that taken care of soon. We are always, again, looking for volunteers to deliver meals and fill-ups. Tuesdays, Wednesdays, Fridays, it seems like it's a never ending. Sometimes Marlis delivers the meals. Otherwise, if she has people dining in, then we fill in from the office. Let me see here. We completed another waiver to continue to operate at 4 days per week at the nutrition sites. The state does require that we typically operate at 5 days per week unless you fill out a waiver. We've always operated at 4 days per week, and it was approved by GWAR that we continue doing that because we are hitting that 5 days. We're open on Fridays and Phillips. So those that want to could technically dine on Friday in Phillips. I've been mailing out the congregate and home delivered meal surveys as a requirement by GWAR, so that is in the process. In our next, well, whatever. We also, Carrie did a very nice nutrition program financial report for us. So it was a breakdown of 2024, all the costs, the expenses. We had 18,820 meals provided in 2024, with the cost of the meals being $80,870. So that was there's a lot of different amounts on here, but was very, very well received, and it's very easy to read. Otherwise, that's about it.
Okay. Questions? Mr. Kopish.
I was inundated with questions yesterday about funding. People are very concerned with everything that's happening in Washington, if it's going to have an impact on our funding for the meal program.
I have not heard anything. I have not seen anything come through.
That's kind of what I said, but I don't know for sure. I mean, is that federal money we're getting on that or not? It is?
State and federal.
About how much do you say of the total are we getting from the feds? 10%, 20%, half,
20%.
20%? Well, that's good, ballpark. That's fine.
No, I mean, we'll have to like look into it, but the funding that we get for that comes through GUAR, but GUAR gets their money from the feds. So it is kind of that channel through that GUAR isn't really giving us any money. It is all coming from the Fed to GUAR, and then GUAR spreads.
Pass through. Yeah.
Mhm.
Okay.
Like
wanna say-
last year, it was around 123,000
That came through that?
for the grants.
Yeah, that
Mhm.
unit, your unit as a whole is the largest receiver of the federal state funding because our Carrie Kyle ran the report of all our federal funding, which we have to do our not series one, what's it called? The audit, the single audit, series one, single audit. And so like we have to list all the federal funding that we get. And do you remember it was like $2.7 million of federal funding or 2.1 million? But I remember your unit as a whole was the largest at like, it was a big number of what the federal funding that comes through now comes through the state, it comes through other ways, but those were the areas we were watching for if there was a freeze or if there was changes, but none yet.
None yet. Okay, I'll report back on that. Could I get a copy of that meal
Mhm.
site thing? Yeah, I'd like to see those. Okay, thank you.
And there's a definition and an explanation, so you know exactly what the amounts are. So
I can always call you if I have
Sure.
any questions. Yeah.
Yeah,
And it's nice to have Cheyenne back.
it is.
She had bingo the other day and I actually did win.
Yeah,
Yeah.
did you?
You did win.
Yeah. Yeah, I won.
All right.
Well, before, Chris does have a really nice handout with some good graphics on there. It's real easy to read. And so if anybody on the board here would like a copy of that, she could email that to you or put it in your mailbox or whatever if you're not. So, I mean,
can
it's
get
very
it to
good,
you.
good information.
All right.
No other questions? Okay, sure. And Dawn? Dawn is going to talk about the Woodland Enhanced Health Services Commission. Both she and I were online, but I thought maybe I'd like to see how this was Dawn's first meeting. So let's see what you thought of it. Okay,
Well, good morning, everyone. So yeah, it was my first meeting. So
Turn the
I
mic back.
I don't think your mic is on. Start all over.
There we go.
Rewind.
So good morning. And yeah, it was my first meeting. So I sat in on it and I'm not sure that I understood everything that went on, but some things stood out to me. So when they did the first, they talked about the budget. And I know they noted that nothing seemed out of the ordinary for 2024. And it sounded like that they fell within what they had planned for the budget. And the main thing that I noticed is that when I looked at the 2024 rates and 2025 rates, it did not appear that there was any change, that they stayed the same. And I don't know, Paula, do you have anything else to add on
Nope, good
budget?
so far.
Okay, so then they talked about the census from 2024, and what I did note on there is that Price County had one person placed in February, March, and April of 2024, and then nothing for the rest of the year. And then they did have an amendment to the agreement. And so it sounded to me like what they were doing is setting a protocol for calling special meetings during the year, what would constitute like notice and a quorum. So I'm not sure exactly what the change was, but it sounded like notice was 5 days and a quorum was now a simple majority for those special meetings. And then they also made some changes for the annual meeting so that if a quorum does not exist at the annual meeting, they would call another special annual meeting within 20 days, and then they would have different requirements for what would constitute a quorum at that meeting so that they could handle their annual business. And that is kind of what stood out to me from that meeting. Anything else?
No, that was actually, you've done a real good job grabbing all of that for someone who just comes in, because it's quite, the first couple of times I was just like, I didn't understand some of the things, but I know in talking to Jeff Hallstrand, who was before on there, he explained a few things. The amendment that we talked about, that you spoke to, was that I want to make sure I get this correct. So last time in August, when we had our meeting, we had an amendment to give Jackson County a full membership instead of just an associate membership. This time we had a first reading on where Clark County was, I think it was Clark County, correct? I think it was Clark County wanted to become whole and not be representing Pepin and I can't remember the other one. But and so we agreed that we would allow that. And so we had that agreement signed. We had a second reading this time for this meeting, and there was one person who wasn't really comfortable about making that decision for his county. But I know Donna Rosar was on, and she is the representative from the Marathon County area. And she was like, we've read it, we've had one reading, we've had a second reading, there was no concern. And I made the comment that, we're all appointed from our counties to make these decisions for that. And, you could drag it on for readings and readings and readings. And so it really was, it was just to give that county, Clark County, to come in with a full membership as well. So we did vote for that, and it did go through. Just the one gentleman wasn't comfortable making that decision for the county. I guess that's why you're appointed to be on the committee. Did you have a question? You're looking. Okay, I'm finished. Okay. Other than that, no, I think you did great. That was good. It's an interesting group, and it's interesting numbers that come through of who's being, and that sheet that you spoke of which you spoke, that number one, with us being there for 3 months with one of ours from Price County, it's just amazing how many are there from other counties for longer times. And that's where we always talk about, Nick has made that comment, the budget might look good. And then suddenly we get a.
Sure. All it takes is a placement or two. And
right. And it'll just go sky high. Yep. So thank you for that, Dawn.
You're welcome.
There's a question. The one placement we had, what was the issue that the person got placed for? Is this mental health, or what kind of an issue are we dealing with?
That one?
I think it was an emergency protective placement, but I wouldn't have been here at the time. But from reading and looking through the manual, because I kind of went through and organized it, and it sounded like it was an emergency protective placement. Am I right on that?
You're right.
Okay.
Okay. Had to pull the person out of the environment and put them in a safe place. Oh, okay.
Dangerousness. Yeah.
Okay, thank you.
Okay.
Anything else?
No other questions for that? All right, now then Dawn is going to speak or talk about an ADRC video.
Yes, so I'm going to talk about the advertising initiative that they've been doing with the ADRC. So this is both a statewide and a local initiative. So the state is doing some things statewide, but we are also doing some things on a local basis. That we received funding for the state for the ADRC of the North. So that's us, Ashland, Bayfield, Sawyer, Iron. And so it was a pot of money that the Northern group got. So the Northern group put together this video. So we are going to play some of them today. I talked about them last time I was here. So Nick, you want to go ahead and play the first one?
The ADRC has a significant impact on our communities because at its base, it provides aging adults and individuals living with physical and intellectual disabilities resources to live with dignity and security.
Knowing that we have this counselor with the ADRC is so comforting, and I feel 100% confident that I have a helper and my partner is a helper.
So that is the first video. That's a 30-second video. And Sarah and I are looking at them this afternoon, but I'm kind of leaning towards using this one. We did develop a contract with the movie theater here in town to play a 30-second video. And that's the one I'm kind of leaning towards, which is why I played it for you, using that as our 30-second video that would play at the movie theater before the movies start.
And just so you know, those on the screen, it's smoother on my computer. It's just
it's
got
a little
to go through
glitchy,
the internet
yeah.
up to you guys, so it's a little choppy, but it is high quality, smooth. The mouths line up with the words.
Yeah, it looks a lot nicer. Yeah.
Did you want to do Angela next?
Sure. So, and the next one we're going to play, there's two that are longer, they're a minute and a half. So Angela here that we're going to play
Waiting
right
for-
now. Oh, sorry.
Go ahead. You keep
Oh,
talking.
we're going to play right now. She is a local woman that volunteered. She worked with our disability benefits specialist to get her disability. So she's one of the videos I'm thinking about putting on our ADRC website. So go ahead and play Angela.
For disability benefits is an uncertain and long process. I was at a breaking point when I was just like, nothing good is going to happen. What do I do? I was down and out of the blue, my ADRC worker called me and said, "Hey, you've got paperwork you need to get on." I got a phone call and I said, "Really? Someone mentioned me? It's not hopeless?" And she said, "No, get in here. Let me help you." And she restored my hope for a while that I'm going to get through this. And if I have more paperwork or questions or concerns, I can reach out to my ADRC worker and she'll help me. And instead of looking at my new disability as a barrier, maybe it's an opportunity to live part of life that I didn't allow myself to live all the years I had dedicated myself to my job. Having the support of the ADRC has improved my daily life and changed that I feel like I'm not doing it alone. I have someone to help me get through the process. Maybe I can still be a blessing to people in some way. Maybe God will still use me to help people, not as a nurse, in some other way.
So Angela worked as a nurse and she was injured and disabled on the job. And Lena worked with her to help her to get her disability benefits. So she did a really good job. We did it at the BW Learning Center and they let us tape there and she did a really good job. So then the last one we're going to play is the long compilation, and this has a number of testimonials from people that use different services within the ADRC and the different counties. So Nick, you want to go ahead and play that one?
The ADRC has a significant impact on our communities because at its base, it provides aging adults and individuals living with physical and intellectual disabilities resources to live with dignity and security. The ADRC also empowers individuals to achieve the maximum level of independence they can so that they can live a quality life within their communities.
And that's what I'm hoping that I'm going to give my mom, the things that she needs.
Yeah, I moved in right across the road from my grandma. So she's got dementia, noticed the need for some extra care. So yeah, we got spun up to ADRC. When we got that stuff figured out, and she just bounced back. It was awesome.
Those that are burdened by the stress of a challenge that life has thrown at them, it slowly dissipates because they have a partner to work through that problem, right? The ADRC doesn't come in and tell you what to do. We offer you options and then you get to plot the course. So you're still completely in charge.
And instead of looking at my new disability as a barrier, maybe it's an opportunity to live part of life that I didn't allow myself to live all the years I had dedicated myself to my job.
Knowing that we have this counselor with the ADRC is so comforting, and I feel 100% confident that I have a helper and my partner is a helper.
Okay. So that's the one. There's other ones, but that's the last one we're going to play for you today. We might use some of the other ones, like at the Sport and Home Show. We're planning to show them there, and some maybe at the Senior Expo that we're working on developing for the fall. So those are, it's just kind of a sample, and just for you to see what the ADRC of the North did. So then locally, take my glasses off. I can't read with my glasses on. So then locally, we're also going to be doing some radio spots. So we're going to do them for a year. And this is again with the marketing money that the Northern Group got. Each county got some to use. So we're going to do some radio spots. And what we're going to do with those is change them each month to highlight a different area of the ADRC. So one month it might be the dementia care specialist. One month it might be the aging and disability resource specialist. So we're going to use that to highlight different areas of what the ADRC does for the community. And then the last thing is I did hand out. So we did a print thing. And we changed a little bit. We did a QR code this time. So if you scan the QR code with your phone, it will take you right to our ADRC website. So I tried it. Carrie tried it this morning. We know it works. So this is coming. We use Park Falls Print and Copy. And so these are just ones we printed on our printers. So they'll look a little nicer. And those we're picking up today. So we're going to use those in the community at the Sport and Home Show to hand out to people. And we also got some that are a little bigger that are poster size that we can hang up around the community. So that is what we did with our share of the marketing money. And yeah, I guess that's all I have.
That's an awful lot. That's wonderful. Any questions?
I got one quick one.
Sure. Mr.
The
Ernst.
sheet that you're getting printed, it's got a QR code on it.
Yes.
How much trouble do the elderly have with technology?
Depending on.
So I don't know. I mean, it depends. You know, some people use it a lot, even folks that are a little bit older. Some people don't use it at all. But we're also trying to focus on maybe their adult children that are looking for help for them too, who certainly, I think mostly do use QR codes. So older phones, you have to load a QR app on. Like my phone is older, I have to have an app, but I understand people with new phones, you could just take a picture of it and it will automatically do it. There's no app needed. So if you have a new phone, you can just take a picture and it will take you right to our website, which will tell you all about our services.
I just downloaded it. You probably heard the beep.
Oh, okay.
It just comes really quickly. And I just have the app, so it's easy to do. But that is a good question, Mr. Ernst. There are many that are not comfortable with that. And I think that's part of what the ADRC and some of the programs that Cheyenne is working on when she works with the senior dining sites to bring this up for people so they're not so worried about that. What do you think, Sally? Use your microphone, please.
I think what she said about the
Sally, microphone. I know. Well, we need to hear your lovely voice.
No, I got calls from Kentucky. We're coming to see our parents. Do you have that you will touch people? I mean, I don't have a phone that can do this, but I believe in it because the families are from away. It can be at the library. They can put it on their thing and look, or on downtown if you have this. It works because don't think the families have spread out to other states even, and they come home at hunting time, at Christmas time, Thanksgiving, anything for them to. I'm for that, even though I don't have a phone that does it.
We'll have to get you an app for that.
And we do have the number on there too. So hopefully we're catching both of those populations. The people that do use the QR codes and then the people that prefer to call.
Could I say one more thing?
Sure, Sally.
I was in the very beginning when they started the ADRCs and being up at the table with the group and all. Oh, how hard we worked to get the signs, had all coordinate the same color every county then, and it was a job. It was a interesting time of my life.
Well, thank you for your service on that. Anything else for Dawn? Anything else, Dawn?
Nope, that's it.
Okay, all right. I would like to just say a couple of things regarding that. First of all, with the ADRC, we were at a Council on Aging, as Chris had reported, in Brentwood the other day, and we were in the meeting, and a lady came up who had been over in Strong Bones, just on the other side of the building, which is not a big building, and she had questions about, she needed some supports. Remember that, Chris? And it was nice because these are the things that we need to really get out because people just don't know that there are so many services that they can help. And Chris could give her the answer right away. So I'm hoping these kinds of things, these are wonderful, Dawn. I hope these are going to go to all the senior sites everywhere, nursing homes, any of those places. Go ahead.
Yeah, we're planning to put them out to, the senior sites, nursing homes, clinics, anywhere we can get them to take them, so that we get the word out there. And I just have to say on a personal level, I worked for home health and hospice for almost 30 years, and I never knew there was a dementia care specialist at the county. I couldn't believe it when I started. How did I not know that? So yeah, we're working hard to get the word out there.
That's good. So each of us need to get that word out if you can as well. And then I want to go back real quickly. I misspoke. I had said, and I said I wasn't sure it was Clark County. It was Chippewa County has they work with they were voting with Buffalo and Pepin, and now they wanted to be on their own. And so these three counties are hoping to be acting individually and independently of one another. And there was a glitch in the agreement that we had to deal with. And so that's what it came back. It's called the Intergovernmental Agreement. Andy Phillips was online from Atolis Law to talk us through that. So I just wanted to clarify it was Chippewa County. Thank you. All right, let's move on. Behavioral Youth Unit, Chana Remarkowitz is not here. Oh, there she is. I'm sorry. She just stood up. There she was. She was hiding.
You shall receive.
There you are. Thank you.
Hi, everybody.
Good
Sorry I
morning.
wasn't here last time, so I'm here to give my quarterly report. I don't know if anybody has it in front of them. I think it was given to you last time, but
Yeah.
they all should also have it. Okay. So as you can see, for crisis calls, October was a little busy. We had 21 calls in October, which doesn't leave very many days in between where we didn't have a call. 11 in November and 7 in December, which is actually pretty low because generally around those holidays we get more calls. So that was different for this year for sure. And then moving on to some of the other programming. And as you can see, we did as many safety plans as we could. Instead of, we try to avoid hospitalization as much as we can. We also try to encourage and find ways to get people in the hospital voluntarily if that's what they want to do. I continue to have conversations with our hospital when people come in and want to go voluntarily to not call us because, again, and I've probably said this to you guys before, so if you go to the hospital with a heart attack, you don't want them calling your neighbor or, or whatever. So if somebody's going in voluntarily, not to call us, but we do have one hospital we contract with that if they decide to place there, they have to contact us because that hospital requires a crisis assessment. I am planning to have a conversation with that hospital because in my mind, that's a HIPAA violation. Because again, somebody walked in your hospital and said, I need help. I need to go to a mental health hospital. They don't always want the county called. You don't want the county called for everything you do. And not everybody else does either. So I understand on one side, they want to make sure that that person's being assessed, that they really do have some suicidality and, concerns for the reason to go into the hospital. But on the other side of it is your staff there are also trained to do that. Can they take 5 minutes to do that assessment instead of involving the county? Because I'm really strong on that. Sarah's heard me say it 1,000 times too. Like, I just really feel like people need their privacy whenever they can have it. So, our intensive supervision program. So again, that's the program for second offense or higher operating while intoxicated. That program stayed a little bit higher. It's not high by any means in numbers, but a little bit higher at the end of the year. I think right now we only have maybe 2 or 3 people in ISP. Comprehensive community services. So that program, we ended the year with 4. And just as a update, as of right now, I did take a look at our numbers. We currently have 11 in CCS now, and that's a fully funded program. So initially, we only get the reimbursement from MA, but then later, like next year, whatever, we go back to WMCR and get reimbursement. So that's fully funded. So that's more money coming into our back to our county, so that's good. We also have 3 more that are started and will be enrolling soon, and 1 new referral in that program. The community support program, so we contract with Aurora to provide that. That's a more intensive mental health program. We're holding at about 21 people. I think that's still currently pretty close to the same. We do have a couple people in CSP that are going to actually transfer to the comprehensive community services program, so that number will get a little higher again. So I'm really happy that we're able to grow that program. Austin's doing a great job. So coordinated services team, that's the wraparound team that we use for students, youth that have some troubles, not only in school, sometimes at home, in the community, trying to help prevent placements. So we're still holding at about 8 or 9 kids in that program. I think she recently got a couple of referrals there as well. Children's waiver program is still holding over 50. So that's a lot. So we're still trying to find ways to help alleviate some of that on Bobby Joe. I did just recently have Austin do the training for children's waiver, so she'll start taking some of the kids that are in children's waiver and CCS. So that'll take a little bit of caseload off of Bobby Joe there, but it's still pretty high. Birth to 3, as you can see, later in the year, it was only 6 to 4. I think currently we have 5, but she's also got about 4 new referrals. So that's where we're holding with those numbers. Does anybody have any questions about our services or the report? Okay.
It's back on. I couldn't get it. It's on the paper, but yeah. All right. Well, thank you, Shauna. Appreciate that. There are some staggering numbers there sometimes. All right. And now we will go to Carrie. I believe you are up, Fiscal and Administrative Unit. Carrie Crow.
Hello and good morning. Okay, so we have our high cost placements in front of us. This does have our year end of 2024 on there, and then also the start of 2025. There aren't any outstanding costs, really, maybe a couple minimal things. So you're not going to see too much fluctuation in the end of 2024. On the children and youth placements, that does capture everything from your kinship to like your secure detention. So while kinship isn't always considered high cost, it still is a placement cost. So just so you know that also is in that number. Then looking at the behavioral health high cost placement, this one too, it does capture your crisis, but then it also does capture costs that kind of help people stay out of like those crisis in situations too, where it can help like them establish a safe place at their home. So that also total includes some of those costs too. So I don't want you thinking like, oh my gosh, all these high costs, where there are still some of these softer precautionary expenses that are in there.
Are there any questions for Carrie? I guess not, Carrie. Thank you.
Thank you.
Mm-hmm. And we'll move on to Sarah.
I wanted to thank Laura Hahn, not Laura Hahn, Laura. Yeah, sorry. Maiden names. When we met in regards to our advertisement, she had met with us and with Carrie and with Dawn, and she gave us a lot of insights. So with marketing, so it was really helpful to have Laura attend our meeting with that. We have you've kind of heard from, believe Dawn, is we have the Sport Home Show March 29th and through the 30th. And we'll have 2 booths there, which will be together, and we'll have senior services, ADRC programs, public health, behavioral health, and also foster care. So we're going to have a good showing at the home show. Also, this coming fall, you had heard mention that Chris and Dawn mentioned that they're talking about having a senior living expo. And it's also what they want to bring to the community is what other activities are there, such as like pickleball or quilting. So they want to have all types of different vendors there. So that's what they're working on. It's not set in stone yet. It's just right now in the works. Also, the agency right now is just busy doing final reports. So gathering data and stuff for grants. We have to do the end of the year reports. So that's pretty much what each unit is working on for the grants now. Otherwise, that's about all I have for agency updates, the personnel updates. Knock on wood, we're doing really well with employees. We just have one opening, except for, I have to say, home delivered meals and substitutes for that. But also we just have one position open in the children and youth unit. So it's really nice to be fully staffed.
Oh, gosh, I bet.
So that's all I have.
Are there any questions for Sarah? Come on, Dennis. I know you just want to talk for a long time now. Yeah. Yeah. You really are. All right. Well, that's it, folks. And our next meeting is April 9th. Right? Are we still going to have a meeting, you think?
So far. Yes.
So far.
Yeah, we've
okay.
been planning all the meetings. We'll let you know about 2 weeks in advance
Right.
if it's canceled, rather than trying to figure out today if we skip them or not.
Sure,
So.
sure. Well, if there's no objection, I will adjourn this meeting. Have a good day. Thank you all for being here.